share with others. And those of you that do know, so in July, Sue Flocky, who is a longtime colleague of ours, moved off to Oregon on us. And she had been the person who had really done the seminar since the beginning of our PRC starting. And then we are very grateful that actually today's speaker, Darcy Freedman, has agreed to take over the seminar series. And so you'll be seeing her up here instead of me for the future of the next 12, 11 seminars, or no, I guess 10 seminars. So one of the exciting parts about it is, if you haven't seen it yet, is that I think this has got to be the record, that we have a new schedule out already for the entire year. And so just to have a couple of notes on it. So in the next, if you don't have them, in October actually, I'm going to be giving a talk on the new CTSA grant, or the Clinical Translational Science Award, that CASE has gotten. And we are we are the leads for the community and collaboration component. So if you're interested in coming and hearing about team science and stakeholder engagement and research, that'll be in October. In November, Dana Prince, who's from the Mandel School, is going to be here talking about community-grounded research to address psychological functioning of sexual and gender minority youth in foster care involvement. So that's the next two. And then just to know that in December and then also in April, our days are a little bit switched. We won't be doing our normal schedule. In December, we're very excited. We have a woman, professor from University of California, Irvine, coming, who is an expert in team science, and is going to be coming and spending a couple of days with us, and probably we'll be having a longer-term relationship with her about how to not only develop cross-investigator and cross-disciplinary investigative teams, but how do you involve stakeholders? So whether that, we talk about this as if you're a lab scientist, how do you engage those that would take your findings to a device or a drug? If you're in a clinical setting, how do you take it and put it into the clinical setting? If you're a community or public health, how do you end up having your interventions disseminated out more fully? And so having those stakeholders involved in the actual research process from the beginning. So that's the December, and that's going to be actually on a Friday on the 14th. Okay, these should be out there. Grab them, pass them around. They're on the website as well. So sometimes the very first slide is the hardest one to fill, but we're very, very pleased and excited for this talk. So I'd like to first introduce Dr. Darcy Freedman, who those of you know is the Associate Director here at the PRC and Associate Professor in the Department of Population and Quantitative Health Sciences in the School of Medicine. She's also been the PI of our core project here in Freshling. But today you're going to hear about a very exciting and innovative project that she is leading, which I think when you hear about it, you'll see the complexity to better understand food systems. And the title of her talk is Integrating System Science into Efforts to Promote Nutrition Equity. So today, thank you.
Great, thank you.
Thanks, Darcy.
And one of the things that we are also going to be integrating into our seminar series this year is inviting one of our network of community advisory board members, so the NOCA of the PRC, to also give very brief remarks at the beginning about who they are, their role on the NOCA, and their beliefs about, or perspectives about why this particular topic of the seminar is relevant for our community. And so Jennifer Schofield is just walking in the door now, so no pressure, Jennifer, but if you are feeling comfortable enough to just roll with it, which all of our NOCA members are, right? Exactly. But Jennifer is the CEO of the Hunger Network of Greater Cleveland. Jennifer was the founding chair of the Network of Community Advisors of the PRC, and she is also a partner and a core modeling team member of this new project. And so Jennifer, do you want to just give a brief introduction and sort of your perspective about why this is important?
Sure. Good afternoon to everybody. I guess my timing was
perfect.
It always takes a little bit longer to get out of the office than I plan on. So again, my name is Jennifer Schofield. I see a lot of familiar faces in the room and not so familiar faces in the room. But as Darcy mentioned, I've been part of NOCA from the very beginning. Even helped Elaine and her early crew write the first grant. So involved since 2008. So for me, NOCA and the work here holds a very kind of special place in the work that I've done in those last 10 years. So I just think the work that comes out of the Prevention Research Center is critical to what we're trying to do on the ground in the community. So I think in particular the work is so important, this project is so important to our community because it's going to help us make all of those links that we've been talking about and we've been trying to do in various places all these years. I think without actually taking those real deep dives into all the different determinants of what it means to have a healthy community that's sustainable. The work that the Hunger Network does is around food access from a nonprofit perspective. So we support 73 hot meal and food pantry sites across Cuyahoga County. We're also trying to help plug in some gaps in the food rescue efforts that are on the ground. So kind of looking at nonprofit food access and linked up to commercial food access to access to health care, to economic development and job training, all of those things that impact what each one of us are trying to do is really important. I am on the core modeling team, so it's either me or our Stay-Well coordinator who's a dietitian. Lynn Hutchison, you probably meet her around town maybe a little bit. She coordinates our Stay-Well program, which is our health wraparound service. So we try to plug in and kind of marry access to healthier food with medical care and medical navigation, all of that. So we see ourselves in this model from those different perspectives. But we also know that by making improvements in all those other different nodes in this model, it might eventually put us out of business, and we'd be okay with that, right? So it's really important that the different aspects of this community, whether you're in education or you're in economic development or you're in health, is really important. In addition to improving our community and really trying to put some of these pieces into place, is it just advances the body of evidence around this work. And I think that's really important for us as a community to acknowledge. So happy to be here. Nice to see you all.
Thank you, Jennifer. And I think hearing that perspective of our community partners is so key. All of the work of the Prevention Research Center engages a community, one or more community partners in different ways. And so, the ideal is when we're able to have that seamless transfer of information in both directions, from the community into the university and from the university into the community, and that becomes a cycle or process. So today I'm going to talk a little bit about this new project that we're calling Modeling the Future of Food in Your Neighborhood study. Its acronym is going to be Food Nest 2.0. We did a lot of conversation about something smarter and catchier, and we couldn't find one, so Food Nest 2.0. For those of you that are familiar with Food Nest, Food Nest is the study we've been doing over the past 3 years. It's funded by the NIH, looking at the impact of opening a food hub in a community with limited access to healthy foods. It was in the St. Clair Superior neighborhood. We have a comparison community in Columbus. We've been collecting a lot of data from people living in the communities through surveys, assessing the food retail environment. And a big lesson learned in Food Nest 1.0 was that even if this food hub became this most amazing food hub ever, we would have completely missed all the things that are happening at the same time in terms of our evaluation. And this is what we all know, but I mean, things are really complex and interacting. And we had a conversation about this the other day, is that the beast that you encounter today is not the same beast that you encounter tomorrow. And we know that with ourselves. The moment that you intervene, you already have a different system. And so things need to be rapidly changing and taking that into account. So that's sort of the heart of the Food Nest 2.0 study. I'll talk a little bit about some concepts related to system science, because that's the kind of the conceptual framework behind the project, and then highlight our initial findings related to perceptions of the core structure of our local food system, with emphasis on factors influencing the 3 outcomes that are the focus of our study. So those are food security, economic opportunity, and nutrition equity. And I'll come toward the end of defining what those mean a little bit, but we don't yet have official definitions of these terms. We're actually defining them collectively as a part of our project. So overall, in Food Nest 2.0, our end goal is to develop credible and relevant computational tools to offer a systems lens within an equity framework to guide local sustainable food system change. And you can see that there are a couple of words that I highlight in there, and the words that we will come to, systems lens and equity framework, more in depth in a minute. But the other 2, credible and relevant, our goal in this project, we actually will do 0 interventions over a 40-month time frame. We're not intervening. We're developing a model to understand how the system works. And as a computational tool, we will simulate artificial interventions, and we can see how they would create an effect. That is designed to eventually become a decision-making tool, so any of our partners would be able to take that information to guide interventions that they want to do. There's nothing stopping Jennifer or Morgan or any other members of our core modeling team from taking a lesson learned that day in a session and applying it immediately. We're not doing, we don't need an baseline period. If people want to make changes immediately, they can start to make changes. And so credible and relevant is important, that the people that are building the model, are intended users of the model, believe in the model, and they think that it would be useful to guide the kinds of food system changes that they might be interested in moving forward. We have a pretty big team. Actually, we have over 30 people working on this project right now. Our main investigative team is right here. I think it's pretty exciting because it's the first time where we've really strategically linked the Prevention Research Center and our focus more on social determinants of health, and the Institute for Computational Biology, which has, and there's a seat right here and a seat right over there if you want to come on up. Hey, how are you? And actually a couple of seats over here too. And one here. So the Institute for Computational Biology, which has a lot of research focus in building big data infrastructure systems for big data analysis. So underpinning our project will be what we're calling an integrative data platform, and the ICB is a key partner in helping us build that. All of us the case faculty are involved in the Department of Population and Quantitative Health Sciences. We also have collaborators from the John Glenn School of Public Affairs, from OSU, and the Albert Einstein College of Medicine, which is where our modeler for the project, David Lounsbury, is located. In addition to our investigative team, we have a peace sign here of the core modeling team. Right now we have 19 members of core modelers. I was trying to figure out the best shape to display this group, and the peace sign came out. But in the end, we hope that all these other little spots will fill up and we'll have more people. It is open, although every single member of our core modeling team, as a part of our principle, is either there because their organization pays for them to be there and they are therefore a matching partner to our grant, or they're there because we pay for them to be there. There's nobody there just as a volunteer. So that's really important. They're committing about 50 to 60 hours of time each year. That we have memorandums of agreement for all of those partnerships as a part of the project. So our goal with the CMT is that we had people who represented different parts of the food system, different actors in the space. The other thing is we wanted people who would be able to contribute data. So some of our partners, even part of their agreement, is they bring data to the table. Other partners are going to be bringing in connections to other community activities. And the other thing is many of our partners are implementing the kinds of interventions that we're interested in studying as a part of the project. And then lastly, we have a great team right now. Our research staff here in the middle, I put Dominique's picture. Dominique Rose right here is our program manager. Perfect. And we have doctoral students, pre-docs, graduate students. And I haven't actually added up Haley on there. We have an MSAS student doing her internship. We have a student over at OSU as well. So we have a great team coming together. And then I think importantly to note, this is a really unique grant. It's funded by the Foundation for Food and Agriculture Research. It was that organization was founded in the last Farm Bill. And its goal is to stimulate research in the space of food and agriculture. Most of their research up to date has been very agriculture specific, things like how do you develop a pesticide, that Monsanto can commercialize. One requirement of all their funding is every dollar they give has to be matched with a non-federal dollar. Well, Monsanto has a lot of non-federal dollars to match with. But in our space, which is the community kind of prevention space, it took them a long time to get this RFA out. And most of their RFAs, they already have secured the matching partners. You don't have to do the work. This one, we all had to figure out who are matching partners. So you can see we have a good list of matching partners there. In total right now, our project budget is over $2 million, and one half of that is funded in match. We're still wrapping up. We're not fully matched at this point, but we're actually pretty close to finalizing our match. And so, one thing, some of our local cash match ones that made a big difference, and I just want to acknowledge, the St. Luke's Foundation, Unify Project. Those were our two big cash matches that allowed us to get this project started and at least get funded for that first year and then round out the rest of our funding. So just a little bit about the project. Our context in this project, we are talking about local food systems, and specifically we are saying low resource neighborhoods in Cleveland. Our idea is that we may be relevant to other Rust Belt cities, but ultimately in our proposal, all we're trying to make sense of is low resource neighborhoods in the city of Cleveland. And some of you may think, why do we need a food systems project when you see a Crane's paper like this that just came out that says, Northeast Ohio's food fight grows. And it's all about the new Lucky's Market. You can actually shop with, drinking a beer if you want, and get smoked bacon in-house, which I'm sure is amazing. And the fight over Giant Eagle and who's going to shop where, and bringing in the various grocers. The reality is that there is a big food fight to be fought, and the challenges around food systems equity and nutrition equity are not likely to be solved with this fight. And so that's one of the reasons why we think this project is so important. We need an alternative model. So just a little bit of background. If you think about Cleveland as this, yes?
We have a car issue, and somebody with their hazards on that we don't want to make. We want to make sure that it doesn't run down your battery.
What car? What's the car look like? Wow. That is just like, there's no big brother in here, gosh. We have some surveillance going.
He's very good at his job.
He is, that is true. So if you think about city in transition, so from 1890 to 1970, Cleveland was one of the 10 most populated cities in the U.S. In fact, we ranked number 5 in 1920. We had a peak population of nearly 1 million. Right now, the county is just, about that level. Our current population of the city is just under 400,000. So we talk about the Rust Belt dynamics of cities like Cleveland or Detroit or Pittsburgh, where there was this decline in jobs, wages, and infrastructure. And currently, Cleveland has the 6th highest poverty rate and the 3rd highest child poverty rate. In the city of Cleveland right now, 1 out of 2 children are living in poverty. And that is not seeming to budge. And I think fascinatingly, we've looked at food systems as a strategy for economic development, and a lot of the people in this room right now were the leaders in that movement. In fact, we established one of the first and most active food policy coalitions. Again, those founders are in the audience right here in 2007. We are recognized nationally as a leader in urban agriculture, and just in preparing the grant, which was submitted about a year ago, in 3 neighborhoods alone, I was able to document at least $20 million of investment to support innovative efforts in community gardening, farmers market, corner stores, supermarket, food hub development, social marketing campaigns, and emergency food assistance. And so, despite that, we still see this persistence of poverty, poor nutrition, and food insecurity. Today, nearly 2 out of 3 Clevelanders live in a neighborhood defined as a food desert. And there's this need, and many of us, again, in the room know this need to address these underlying structural factors, such as segregation, racial equity, and poverty. And that these are not new, but they're really historically entrenched. And so if you think about a system, how do we unpack and take into account this history of inequity in our community? And again, most of us in this room are already familiar with these redlining maps. The map on the bottom of that picture is the 1939 homeowners loan corporate grades. And the different shades are telling us the kinds of loans that were given out. And so the grade A's were the best loans, B's indicating areas that were still desirable, C's were definitely declining, and D's were graded indicating areas that were hazardous. And D would be the red, hence redlining. Okay? So this is a map, I like it because it just pulls out, not only are there a lot of disparities underneath that we can measure, but if you start to go in and look at what's in the neighborhood environment, like those pictures show, the kinds of community resources that would support a healthy growth and healthy development are very different. And if we look, we could pretty much pull any statistic in the city of Cleveland, and they're going to see a very strong correlation with that redlining map. So this is just one very relevant to our project. Here is looking at obesity among adults, and again, you see this darker red in those areas where you had redlining in the past. And so in this particular project, we look at those data, that history, the story, and we see it as an opportunity to reconceptualize the food system's problems and solutions with a focus on equity, number one, as the goal. Not about economic development for Giant Eagle. So equity as the goal, and using that systems approach and seeing that all of these things are interconnected. There's not going to be a silver bullet. And even if there was a silver bullet, we'd need a different bullet the very next day because the whole thing would have changed. And so for us, number one guiding principle is this idea that equity is the framework that we're going to operate in. And again, this is not new for many of the folks in this room. We are striving to operate in this space of equity. For us, it has meant a lot of discussion about what we mean. And I don't think we know yet what exactly we mean, but there's some key parts here. First of all, that our work in examining inequities would happen through a collaborative dialogue. And that's why we have a core modeling team. That's why we have plans to do public convenings. That's why our goal is to be as transparent as possible in the process. So it is about a shared dialogue coming together to focus on the most vulnerable community or the populations in our area. The second one is that we assume that trust is a catalyst of change. that means that, especially in our group, that's probably been one of the biggest discussions we've had so far, is how do we establish trust with each other? We're going to have to reveal, I mean, Jennifer just revealed a pretty big statement. Hey, what if this means our work goes out of business, over time? When you think about a recalibrated system, people are going to need to pivot in certain ways, and that does require trust. And so figuring out ways to build trust, I think transparency for us is really important. And then lastly, this idea, and I think it aligns so much with systems science, is that the process is probably more important than the outcome. Because the outcome immediately changes once you've gotten there. And so how we go about is really more important than what that end goal is that we achieve. Because the end goal will always change and there's always something new to focus on. And so process is key for us. And then the systems lens, this is basically take into account, first of all, that the way that systems work, the things that we have, the fact that Cleveland is the 3rd highest child poverty rate, the 6th highest poverty rate, 1 in 3 adults live in a food desert, that is exactly what our system is designed to do. That's not random. That's not chance. That is the goal of our current system. That's status quo. And so for us, thinking about changing any dramatic shift, if we were to go from 1 in 2 children in poverty to 0 or 1 in 10, it would require substantial transformation of the system. Not only the parts, but also those relationships between parts. And this assumption that community transformation is nonlinear, dynamic, interdependent, unpredictable, and adaptive. So a lot of times in systems science, you'll use the example of, and it's a good one to actually have a cup of water here. And if I have an empty cup of water and I put in 1 drop, it hardly makes a difference in this cup. But if my cup of water is full, and I add in 1 drop, it starts to overflow. I add in 3 drops, it's really starting to overflow. So that, the 1 unit in does not lead to 1 unit out always in a system. Sometimes 10 units in, 10 drops makes no difference. When it's full, 1 drop makes a big difference. And the last point is that it's important to move away from change models based on the piecemeal approach to intervention that rely on linear models analysis. So if we do this, then we do that, then it will lead to this. And it never loops back around. That end goal actually influences the starting point. And sometimes I think it's helpful also to clarify the difference between things that are complicated and complex. So complicated is this, right? This is really, really complicated. Most of us would have no idea, me included, how to do anything related to that picture. I just hope it works when it all goes, right? But if you need to put in a bolt in, somewhere on this plane, it will always go in, and if you turn it, it will always screw, unless it's broken. And then you just have to fix that one part. If this plane flies to Tokyo or it flies to Cleveland, it's the same thing. It doesn't really matter. Sometimes the wind flow will make its speed different, but it generally, it's very, very complicated, but it's not complex. It doesn't time vary in terms of its functioning. This is a complex problem. Why is that a complex problem? What do you think?
A lot of history involved, a lot of ill feel.
Okay. So there's some history.
And fear. Ill feel.
What was the second?
Carrots in my mouth. Ill feelings.
Ill feelings. Okay.
Fear.
Fear.
And
misunderstanding.
Okay.
I said misunderstanding.
Okay.
It's not simple.
And why?
Oh, are you asking why it's complex?
Why is it complex?
Because it's not simple.
Because it's okay, good definition. Right. So I mean, it's not. If it was simple, I mean, our reaction to this situation. I mean, there are so many levels of events that have happened currently, historically. There are a lot of complexities to this person as an image, to the police officer as an image, to the city of Dallas as an image. I mean, there's just so much going on. To be able to make sense of that, I mean, there's not one solution. If we could just get this thing right, we would probably not have this problem anymore. We can see that all the parts really start to interact with each other. And once you start thinking in systems, like every single news story you hear, you're like, oh, that's complex. Let's start to map out all the system parts to this problem. So in food systems, of course, they are complex. And they're understood differently from different perspectives. And a lot of us have seen this metaphor before of the people seeing the elephant. And of course, somebody comes and they touch the trunk and they're like, oh, I think it's a snake. And somebody comes and touches the leg and they're like, oh, I think it's a tree. And that's the same thing in terms of the way that we understand the food system. If you work in emergency food assistance, if you work in food retail, if you work at a farmer's market, if you're a person receiving SNAP, you all are touching different parts of the food system. And you're coming up with a different story. And so in our project, for our approach to build our model, we have selected to use a method called Participatory System Dynamic Modeling, or PSDM. But this idea that we need multiple perspectives coming together to build the model. There's no one that understands the model fully. And ideally, as a group, we'll have, we won't ever fully get the model, but we'll have a better representation. And so in system science, there's this idea like this elephant is reality. There is some reality out there. There is a food system out there. But it's really our perceptions of that reality that we're trying to capture. And in system science, we're in system dynamic modeling, we're moving from the perception to get a mental model, to capture our mental model of the system. And so if you think about it, in this example here, it's like drawing out, well, what are the components of that tusk? How do we really understand what does it look like? Where does it fit relative, how big is it? And that mental model is then designed to inform decisions and actions to implement policies and programs which would then have an impact on what we're trying to understand as reality. So in system dynamic modeling, that tusk drawing is done through here, which is called causal loop diagrams. In a minute, I'm going to share a little bit about our draft version of a causal loop diagram. So those represent our perception, our mental model of reality related to the food system. And the other thing about systems that I actually think to me is the most exciting thing is the idea of thinking about intervention. I'm an interventionist at heart. I really am interested in figuring out how to change things, transform things. And so systems theory, this is a hierarchy of places to intervene in the system. So at the very bottom, power to transcend paradigms, and then at the very top, parameters. The higher up you go, the less effect your intervention would have. So in the top area, changing parameters, you could change feedback, you could change design, and then the most impactful way to change a system is at the intent level, at the transcending paradigms is like we've reached enlightenment in the Buddhist state, and we no longer think there is a box, right? We always will deal with reality as it comes, and we won't force it into any lane or path or whatever. Most of us aren't able to achieve that state, right? Hopefully, maybe to number 2, we could get there. So, many times though, when we think about intervention, we come in at the very top at 12. We try and change parameters. What would happen if we just need one more farmer's market here. We could just get one more food pantry or one more corner store project or one more of this or 3 more of that or whatever. From a systems perspective, that is the least effect in terms of whatever outcome. And many of us, that's where we spend all of our time, is trying to change parameters. For us in this project, we're trying to get at number 2, changing the mindset, the paradigm out of which the system arises. So for us, really starting off, how do we shift the goal of the food system? So the overall purpose to promote economic opportunity, food security, and nutrition equity. Anybody who works in the food system writ large knows that is not the goal of the food system. If that was the goal, we would not be seeing marketing to children for Pepsi all the time, right? Or we wouldn't see that the prices for healthy food are more expensive than unhealthy food. So that's a pretty audacious starting point for us. But we are going to build our whole model based on those goals, which may mean that we'll find new interactions, new connections in the system that may not be as intuitive, if we focused on the current goal of the system. So in our project, we have 3 phases. The first phase is our model building to capture the complexities of the system. Step 2, model testing and refinement, and then model application and validation. And this is kind of a common practice for model development because, the model is going to be only as good as its design. And so how do you get people involved in forming the model and then the data underpinning model? So we don't just build a model, a picture, but we test the model quantitatively to see, does it play out in the way that the data would, we can pull real data to see how things are working. Is it playing out the way we would expect it to play out? Is it able to predict some kind of future change? So when we think about system science and like I said earlier, simulation modeling, at some point we'll feel good about our model. We'll actually simulate out different possibilities, different time points. So we can say, well, what happens if we actually followed this 5 years and 10 years out? Most system dynamics take a long time to play out. They won't play out in 3 months, 6 months, 12. 5, 10 years to be able to see something. So some of the advantages is it gives you capacity to model multiple processes at the same time. You can test these plausible, we talk about them as what-if scenarios, various interventions. You can think about them as hypotheses. Understand the magnitude of intended and unintended consequences. I think that's also really important. We know the unintended. Sometimes we don't know the unintended consequences. And then have the option to adjust and refine simulated intervention designs prior to that actual real-world implementation. Our goal is that communities would be able to play out scenarios and then sort of make the best decision of where to intervene. We only have so many resources. What would make the most sense for us now to have the biggest effect? So in terms of phase 1, which is right now in our project, we're doing 2 main methods for building our model. One of them is with our core modeling team. We have now had maybe 20 hours of training and interaction with our core model, maybe even more than that. And that's the bottom part of there. We have bi-monthly core modeling team meetings. We had a 1.5-day long retreat. Our goal with the core modeling team is not only to build the model for the project, but it's very much a dissemination back to build capacity within our local infrastructure for systems thinking. So one thing that we do with the core modeling team is make available all of the scripts that we use for the project. So anyone on the core modeling team, if you wanted to, or if they wanted to, they could download the activities and they could start to replicate. Some of these things you could start to replicate even in your own work, even if you don't want to do the whole thing of building a model. The second thing is we'll be doing some qualitative interviews. So not everybody can be in the core modeling team. Some people just don't have that time to commit or the lack of interest. But we want their feedback to inform the project. So we'll be doing qualitative interviews probably starting in November, with key stakeholders trying to understand how people make sense of the local food system and the various dynamics that should be included in our model. So in that qualitative interview phase, we're really thinking about three main groups. Residents, so we want to make sure we have people living in low-resource neighborhoods in Cleveland. Retailers, we don't have a lot of retailers on our core modeling team, and it's unlikely anyone would have time as a retailer to do that. And then the third group are people we call regulators. Regulators could be people representing government, they could be people who really shape norms and beliefs in the system, they could be funders, people who have the ability to shift and pivot the system in ways that might be different than the resident or the retailer. And then second phase, which really is ongoing, but largely will be moving into like years 2 and 3 of the project, is the model testing and refinement. So one of the ways that we will be getting feedback in testing and refining is through public convenings. The first round of public convenings will start in the winter, spring of 2019, and then again in 2020. The purpose of these, some of them will be kind of like focus groups in some way where people will come together and give us feedback on various parts of the model that they may have particular expertise. In probably May of next year or June, we haven't set the date yet, we will have a big public convening where people will have a lot of opportunity to interact with the model, move things around, give feedback, say they like it, they don't like it. But the goal is by the end of that, we would then move into the phase of simulating various scenarios, or those what ifs. So we want to make sure we think the model represents the reality of our system. We want to make sure it's the data behind it are showing that reality is validated, and then we want to start to move into the testing. Another big part of the project is that underpinning this model is a big database. I said earlier, we call it an integrative data platform. So every part of the model, every variable, we need a data source. And there are a lot of different ways we can get data. Some of them are going to be publicly available data. That's actually our goal, that every variable in the model we could get from a publicly available source. That allows us to scale a lot easier. Some of our research questions are going to be, does it matter from a sensitivity perspective if I use this publicly available, a little bit fuzzy variable or a very precise variable that took us a huge amount of effort to collect? If it doesn't make any difference, that's pretty good news to share the model. If it does, we may be able to offer some guidelines to other people, like, hey, this actually seems to make a difference. Here's how you would estimate the parameter if you don't have it. You can pull ideas from the literature. We can use expert opinion as well. If there's a variable in our model, we have no data source, we could bring people together to say, what do we think? How can we parameterize that variable? And then the last part of the project in that model testing and refinement is simulation. We can simulate parts, so smaller loops in the system, the whole system. And we've talked about this acronym as sort of guiding our process of testing, of learning when to sit, the idea of sequencing. So, does it matter if I do A then B versus B then A? If A then B is how you have to do it, then if we can only do B then A, then you might as well not do B or A, right? Or integrating. A and B have to be done together, or don't do A and B at all. Or tailoring, A works for everybody. B could be B1, B2, B3, B4, B5, depending on the community that you're in. So that is a big part of our work in year 2 and 3 is simulating out and seeing the impact of different kinds of intervention in the system related to sequencing, integrating, and tailoring. And then the last phase is the application and validation. Our plan is to take the tool. So by the time we reach phase 3, which is years 3 and 4 of the project, hopefully we've built a model, The model's validated. We've played out different scenarios. We've continued to refine. We feel pretty good about our model. We now have, so that's the back end. Community members don't really need to see all of that. They need a front end side of the model where they can start to input decisions, answer questions, whatever it might be, and start to see output from that. And make decisions like, hey, we're deciding between, do we do some gardens? Do we invest in workforce development? Do we do the after-school program? Can we help get certain women into jobs? Whatever it might be, what's the impact on those three main outcomes we care about? Again, in our project, the whole model will calibrate on economic opportunity, food security, and nutrition equity. We'll work in those three neighborhoods in Cleveland. And then the first time will probably be a big learning curve. And hopefully after doing 3, we would have something to share with other places to say, here's a process you might be able to use in terms of thinking about decision making. So the name of the game in system dynamic modeling, there are other systems methods, agent-based modeling, social network modeling. So in a system dynamic modeling, systems are the name of the game, and you usually start off with these causal loop diagrams, or CLDs. So just to get us thinking in feedback loops, so feedback loops, you can see that all of the lines connect into a circle, and they have a polarity. Positive meaning that things are moving in the same direction, negative in opposite directions. So in this particular example, it says required amount of coffee to function. So as my required amount of coffee to function goes up, my coffee gap goes up. I have a bigger gap. I have a bigger need for coffee. So that's positive. As coffee amount goes up, my gap goes up. As my gap goes up, my drinking goes up. If I have a big need, I need more coffee. So I drink more coffee. As I drink more coffee, I consume more coffee, and that's positive. And as I consume more coffee, my gap goes down. So all other things being equal, it's going to be like this, because it would go down, and because it went down, I would drink less coffee. I drink less coffee. I consume less coffee. I consume less coffee. My gap goes up. So now I need to drink more coffee. So this is a line that would look like this in terms of my coffee gap. It would go up and go down, up and down. And if you imagine intervening when it was on the upswing, you could have done the teensiest little thing, and it looks like it had a big effect. You actually were just riding the wave of that dynamic. If you were on the downswing and you did that same intervention, it's just going to, it would require a lot to shift it back up at that point. So for our project, we moved from drinking coffee to needing coffee. Our gap is very big when we go to this kind of a model. But basically, this is the model we submitted when we wrote our grant. And in this particular picture, a couple of pieces of transparency. One is that we didn't have time to engage the whole community in building this model. So we developed the model. We do a lot of work in the space, so we had some sense. We got some feedback. We'd been working on a lot of projects in this area, but we needed to write a grant in 4 weeks, and so we put in a picture like this. But mainly, we found there are a couple of key loops related to the local food system. And I just zoomed in on loop number 1, which is a loop that most of us can understand. So loop number 1 is the supply and demand dynamic. So supply of commercially available fresh and healthy foods. As that goes up, price goes down. As price goes down, demand goes up, opposite direction. As demand goes up, sales go up. As sales go up, supply goes up. And you can see that that's actually considered to be a reinforcing loop, because all other things being equal, it would just keep going up, 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 up. There'd be nothing to pull down that dynamic. Of course, we know there are a lot of things influencing each of the variables in that loop, like demand. Demand is not only influenced by price, right? And so one of the things that we did with our core modeling team, and one of the parts of this method is you try and put stories into the model. So, for example, one of the stories that came out, when we did this early work with the CMT in June of this year, is people would tell us a story, well, like, hey, I know an experience where, like, it didn't matter. Like, I know a lot of people where healthy food is cheap, but they still don't buy it. Or I know people where it's expensive and they do buy it. So that is a time-varying dynamic. There's something complex going around there. It's not always true that if price goes down, demand goes up. And what we decided, in the true spirit of our project being participatory, is that we all saw this picture. We told stories with the picture because it helps you get some sense of what systems modeling is and even our food system. But then we put it aside. And we said, we're going to build our model from scratch. We may end at the same place, but we won't be constrained by that model as a starting point. And so we began to develop our causal loop diagram, and we had two main questions kind of guiding it. One of them is, what are the parts and connections of the local food system in low-resource neighborhoods in Cleveland? And then how do these parts, how are they related to the outcomes of food security, economic opportunity, and nutrition equity? So before we present our preliminary findings, Dominique has put a lot of paper around. So just take a minute, and on your paper, if you need some, we can pass out more, and there are some markers, or you can use your pen. What is one variable that you think should be in a model that depicts a healthy, equitable, and sustainable food system? So you're going to actually hold up your variable in a minute. So go ahead and just think, what would be a variable? Something that is going to be key driver, facilitator, barrier, whatever, of a healthy, equitable, sustainable food system. And all of us eat, so I think we all could think of one thing influences your own ability to eat what you want to eat. Feed your kids. Feed your community, whatever you do in that space.
Before you get
Be ready to pass these out. More or marker? Yeah, and maybe give her half the paper so she can pass it. So I hear some frantic writing, then smell the Sharpies.
Sweet smell?
All right, so go ahead and take your paper and put it up in the air and just like everybody kind of look around and see what people have.
When Darcy says something.
Okay, so people can see a lot of variables hanging out in the air. Nice. I'm going to show you, and a lot of your variables are on our model, but now I'm going to show you a picture, but Dominique and Haley are going to pass out this because it's a little bit hard to read. This is our starting point based on the first retreat of the core modeling team. This was in July 31st and August 1st of this year. And you can see that we kind of shifted our image a little bit cornucopia shaped. So when you guys look at this picture, what stands out to you? Is there anything that stands out? Socioeconomic status. Okay. What else is influencing or is involved in this local food system depiction that stands out to you? Jobs.
Transportation access.
Okay. Money. So, in this particular picture, there are The green represent what we call tipping points in the local food system. That's the whole RFA that we applied to is called tipping points in the food system. Where are those leverage points for potentially making a shift? So for us, there are 4 main tipping points: use of emergency food assistance, fruit and vegetable incentive, neighborhood access to healthy food, and then positive media and nutrition education. Our next job as a core modeling team and in those winter public convenings, we are going to be each of those are really complex systems in and of themselves. So that's going to be one of the future activities of our team. Something that also is key in system dynamic modeling is this idea of endogenous, the within system, and the exogenous. The things that influence the system but we don't necessarily want to predict. And that's a hard thing to do as a project because many of us see everything, right? And you can see here, like things like addiction, incarceration rate. One challenge that we're going to have, and it won't be easy, but I think it's going to be really important, is we're going to have to put up some guardrails. And we've already started to think, like there are the things that are sort of over here that are in many ways exogenous to the food system, but they make a big difference in the food system. Some of those we may need to bring in as we move down the ladder of system intervention opportunities, like for example, transportation. One principle in systems intervention would be connecting parts that aren't normally connected. So like transportation becomes this big connector between things like employability and demand for healthy foods. So as we're moving forward, this is the start. It will grow. We actually have a file, and maybe we'll put it up online. That might be worthwhile to do, is the iterations of the model, because the model literally changes every time we meet. That's why it's important to date the model. We gave you guys the picture today. You could take it, but if you came back in November, you'd have a whole new picture. So just be aware it's an evolving thing. But we can't focus on every part all the time. So our next big deep dive in the model are going to be in some of those green areas. And eventually, the way that you build these models, we're using what's called a modular approach. So you might have a high level that might be simplistically representing a lot of complexity, but then a lot of smaller models within that take into account various kinds of dynamics within the system. So the other big challenge for us is figuring out what do we mean when we say we want to promote economic opportunity, nutrition equity, and food security. Well, these are really important because if we don't know what our preferred state is for those three, our model could be completely off. Our model ultimately will be designed to figure out what will make the needle move on these indicators that we've defined as being important. So if we don't collectively agree on what's important, we could create a model and test system interventions that move the wrong needle. So our big step right now is the stage of what do we mean by our preferred state? And again, I'm going to be sharing very preliminary data. We actually had a core modeling team meeting last Friday where we started to do more work on this. It's not the end, but it's I think a step forward. So when we talk about defining the preferred state of these three main outcomes, for economic opportunity, there was a lot of consensus that we're talking about educational attainment for professional and vocational training and availability of living wage jobs accessible to residents. So again, just kind of taking it back into the model, that means that we would be working toward a model that would help us understand how do we move those two needles, or what happens if those two needles move, how does it affect everything else? In food security, there was a lot of consensus on this idea that food security was having adequate funds and resources, which could be both cash and public assistance, to buy enough healthy food for your family. So some people talked about this as on cash flow after rent and bills. And then the third one, which has probably been the hardest for us, because nobody knows what nutrition equity is is nutrition equity. And there is, this is where our group kind of came to some consensus that nutrition equity was quality, variety, and prices of healthy foods in local food retail. And I think this is still needing to be refined a little bit. And then ability to choose the healthy option. So we know it could be there, that whole idea of like, if you build it, do people come? I mean, it can be there, but if it's not normative, if it's not what I like, if it's not how I grew up eating, then I might not still choose that. This idea is a concept related more to theories of freedom. So this is our start. Again, for us, this is going to be absolutely critical that our core modeling team and our partners as we move out all are agreeing that these are good goals to try and achieve within the food system, because those are then going to be the needles we try and move through various interventions. And we also will look at, we kind of think about these as almost like Maslow's of like, first you almost need food security. Then you can move into the economic opportunity, and then, nutrition equity. It's really hard to have the freedom to choose if you're food insecure. It's almost inherently not possible to be free to choose if you're food insecure. So what's next? A couple of things coming up over the next couple of months. So one thing we didn't talk a lot about today, but it's a key data source for us, is we are maintaining our food nest study cohort. We have some of our data collector crew in the room right now, and we will recruit an additional 120 people to join that study. So we'll have about 500 people in Cleveland and in Columbus over the next 2 years, continuing to provide their dietary recall data and their psychosocial survey data. The nice part for us from a system dynamic modeling, and one of the big challenges of these, is they don't have data to empirically validate the model. We have a testing data set, which is our first 3 years of food nest, and now we have a validation data set, which will be the next 2 years. So we have two separate sets of data. We can do that work analytically. Secondly, we'll be collecting the food retail data. We've already added in 2 neighborhoods, Buckeye, Shaker, and Huff. And then we'll continue per our normal schedule in St. Clair Superior and Southside neighborhood in Columbus. And then we'll continue to develop our core modeling team. Like I said, we hope to engage some more people. If you feel like, wow, I need to be on that team, you can talk to Dominique. We're definitely open. It is a fairly sizable commitment of time, but we are interested in having partners join. We'll be doing the qualitative interviews starting again in November. And then lastly is moving into these public convenings beginning in winter of 2019, focused on our tipping points. So with that, thank you.
Do you want to facilitate any questions?
Yes. Well, either way.
No, good.
Any questions?
I'll start with one, if you don't mind.
Sure.
It's more of maybe a technical question, but I'm always curious about when we talk about like social determinants, which is like a lot of the things in the model, right? We always assume that they individually have. Does this model have an effect? Does this model have the ability to figure out like which things just coexist versus which things are the things that actually are the drivers? And I think they're different. They're all sort of in that same pot, but they have different roles.
Right, right. So I think that they are, I think it also takes into account if you change one of those, how changing one, like for example, if you change education in the community, how it feeds back and influences, livable job opportunities,
So if it equally affects both of them the same way, then you probably know that there's a coexistence rather than...
Yeah, I mean, I think there are ways, and then sometimes you're going to say, no, we don't want to do it in systems, we want to pull it out in our traditional analytic methods. A lot of the times you validate the system dynamic through a traditional analytic method. So we would predict that this is what would happen based on the traditional method, and now we would see, does it play out that way?
Okay. That'll be a big contribution, because I don't think there's a lot of folks doing that.
Yeah, I mean, I think that the thing is there's so many kinds of research questions you can explore beyond what we have once you get this thing set up,
Mm-hmm.
Yeah.
I'm just wondering,
Yes. Yeah. So one area it could come in is under the bucket of neighborhood food access, in the sense of, there are, like in the school, or, not just in retail. One of our potential funders, new funders, the Michael and Susan Delf Family Foundation, they are particularly interested in school food. And part of our proposal to them is that we would actually develop a separate model just for school food, because there's a lot of other dynamics that may not come in for some of the other elements. So it is not a key tipping point that we put into this model, but we could put in, just say, hey, there's a parameter, an effect of, like, if there's more healthy foods available in a school, it's going to change norms about healthy eating.
Right. It also can change the dietary recalls of people in the community.
Right. Yeah. In our survey data, we only have adults, so we don't have, like, it wouldn't affect it in that sense from the kids. Any other questions?
Can you explain how this is going to work? Like,
Louder, please.
can you explain how this is going to work in HUP, let's say? How it gets to that point in the
So for the reason why we picked the neighborhoods that we picked is trying to find neighborhoods where there was something going on in terms of the food system was changing. So like HUP is about to get the new Dave supermarket. So we'll have data that we can look at, like before the Daves and after the Daves. And so we'll be able to have some validation of the model in terms of does it play out?
Like if you put a supermarket in, which is one of these key,
Yes.
these key points.
Yes. And then, but specifically in the neighborhood, we would then think about, well, what else do you guys want to do in your neighborhood to make a difference on those three outcomes? And how would you think about the various combinations of interventions that might make the biggest difference, depending on which of those three are most important to you?
Are you going to look to see what happens on pain after they...
So that's another tipping point, is what happens when a store goes away. And again, exactly. So for St. Clair Superior, we'll be able to look at the impact of a store leaving the community, and in Huff, a big store coming into the community. And both of those being important tipping points.
But if I was to test myself, just on the basis of my gut, I would say that the two most important things we could do to change nutrition are to work with giving kids better, healthier, fresher food, most easily done in the schools, and doing cooking classes to get them to try things in house. And I'm not seeing anything that looks like it comes anywhere close to that.
So the cooking classes could potentially fit into the nutrition education component. It's more than nutrition education, but we could think about it right now. But you're right. So these are some of the limitations of the model. We have limited. In order to apply every tipping point, we had to show there was financial investment in making that happen. So, there are actually financial investments in the school food, and so we could put that in. We kind of gave ourselves some boundary, and also knowing that, there might, and we can add if we would like to, or we can say, there are some things we want to explore in the future. But school food, like I said earlier, we may at least have an indicator that we could put in the neighborhood food environment, or the nutrition cooking classes, I think, could come into nutrition education. And just also, we have things in the model, like if you look down here, like preferences for healthy food. So we could say, oh, well, we think there are things that could make a difference in that. That would be like, if your exposure of the salad bar at school, or also the family foodways come in around, if you take a class and you start to really shift the dynamics of the way that you eat in the household, and your next generation of kids, they're now eating a different diet than maybe what you ate.
The farm-to-table snacks in our schools have had a big change, in that at the beginning the teachers reported that there was just tons of being thrown away, and that as time progresses, more of the kids eat it. So just having it there
And that's a good system dynamic. It's like, how long does it take? That there's some normal, norm shifting that needed to happen that takes time before people, start to really adopt that behavior.
I didn't see Central in your study. Central community. Is that because of the corner stores offer a little bit of fresh fruits and vegetables?
Well, so Central certainly would be a community that would be very relevant to the project, and we do hope to be engaging specifically in the Central community part, largely as we move into some of these feedback sessions around how do we make sense of these interventions like corner stores. There is a possibility that we'll, think about applying that tool in the Central neighborhood. So I think if Central is interested, I would love to talk with Central.
Okay.
Good. Yeah.
As a end result, do you thinking more about purchasing of healthy food or consumption of healthy food? Because it seems to be tied to like the economics in the food choice, either at an emergency food assistance, the way that food's acquired.
Yeah.
I'm not seeing as much of, in this particular iteration of the model, about what actually is consumed and the ways that you consume food that have nothing to do with your choice.
Right. So that's a really good question. What is the outcome, what you actually eat? Is that what we're going to have the whole model be focusing on? Or, like that issue around that choice? We think that's an important indicator of nutrition equity, but it's really hard to measure. Demand is one of the key factors in the model. You'll see a lot of arrows. Demand could be measured in, for example, what people eat. So say like an indicator of demand is the kinds of foods that people are putting in their bodies. Maybe through a dietary recall would say, there's evidence that there's demand for the foods that people are actually eating. So I think it will be that what people actually ingest will not be the central focus of the model, but that it is a key parameter in the model that we think is important. But it may not, like from the paradigm, it may not be what we focus the model on. Not focusing on how do we get more into your body, but how do we get your ability to make the choice to put that in your body.
Okay.
More of a statement than really a question that's peripheral to this. So some people have, instead of having children, that they're most concerned about making sure that the children eat healthy foods and have healthy availability choices, but they have pets. Now, they might be medical need pets, or they might be, and it was just because I was interested in an article that I was reading about this. There was someone who I talked to about it, and I was just curious on their perception. And they said, well, I won't eat healthy if I can't feed my pet, because to them, their pet was their child. And it was something I didn't expect. I mean, it kind of took me off into left field a little bit. They said, but this is your pet. But to them, that pet wasn't a pet. That pet was their companion. Pet was their child. That was their family.
Yeah.
And so this was a person who was teetering towards latter middle age, maybe early geriatric age. But to them, their food consumption was less because of their need to feed their pet.
So I'll just end with a story from when I was collecting data as a part of my dissertation in Nashville. And we work with these children involved in Boys and Girls Club. We started farmers markets at the Boys and Girls Clubs. And one of the things they had to do was create a commercial about their farmers market. And there was this girl, teenage girl, and she gets a piece of paper, she crumbles it up, she pretends like it's an apple. So she's there, she takes a bite of this apple, she's like, man, this apple is so bad, not even a bird would eat it. And she throws it on the ground. And then she goes, come over to our farmer's market, where we have apples that taste good. And so your question it's funny because I heard that narrative multiple times. Like, we have people given food that not even a bird would want to eat. And that's sort of like, that's the heart of the whole project. Like, how do we make sure that the food that's available to everybody is food that we all would want? So I think that hopefully people can feed their dogs as good as they feed themselves. But, I think it's important that we have an inequity issue. So,
And I think it's just, I'm going to buy less expensive food so that I can afford the dog food.
yeah, and
I mean,
people
so-
do those sacrifices for their children, and yeah. So I think we're actually over time, so we'll wrap up.
So, yeah, so